going to talk about how that drug order is converted into the um, prescription that you're going to dispense to the client. So we need to talk about some terminology. The dose. The dose is a specific amount of drug, usually expressed in milligrams or grams, that is given to a specific patient at one time. So, for example, it would be 50 milligrams of a drug or 10 grams of a drug administered to that animal um, in just one time. The dosage is what we use to calculate the dose for a specific patient. So it's expressed in terms of milligrams per kilogram or milligrams per pound, or sometimes grams per kilograms or grams per pound. But it's relevant to any animal. We just take their weight and multiply it by the dosage, and then we'll get the amount that we're going to give to the animal, and that's the dose. The dosage form refers to what we're going to actually give to the animal. And it's usually a tablet or a capsule, or it might be milliliters of a liquid of a specific concentration. The dose form should not be used as the primary way to record uh, the medication an animal is given. It really should be expressed in terms of dose. So we want a specific amount in milligrams or grams that we're giving to the animal. We can also put in the record what milligrams of tablets, that we're giving. We should have that in there, but that is not the primary way that it's recorded. It's recorded as a gram, a term of mass. So we have to complete um, everything in the record, and that includes how long in what frequency an animal is uh, a drug is given to an animal. So the total dosage regimen that we're going to put into a record is going to include the mass of the drug to be given to the animal, that's the dose, the route by which the drug is to be given, how often it is to be given, and how long the drug is to be administered for. So that time between the doses, the how often it is to be given, is also referred to as a dose interval. So it might be every 12 hours, every 8 hours, and then how long the drug is to be administered is usually expressed in terms of days or weeks. And looking at the difference again between the dosage and the dosage is, in this example, is 5 milligrams per kilogram, but a 10-kilogram dog would receive a dose of 50 milligrams. And I've got the calculation there. We will be going over this in a lab, so we'll get more um, hands-on experience with using these terms and how we would write it in a record and how we would calculate it for a specific animal. So this 100 Dalmatian from 101 Dalmatian, we don't want this to happen to you. Drug mistakes can kill. So your book goes through a list of all the different tasks that have to happen between when your veterinarian gives you the drug order and when you're handing the drug and explaining the drug to the client. And the whole goal is to give the animal the appropriate drug in the appropriate form and make it easy on the client to administer it to their pet. And we want to have practices in place that help protect our patients and make sure that we're giving them the correct amount of drugs. So, some simple things that you can do are these simple things right here, and that is to triple check your work. So triple check the drug label. When you take the drug off the shelf, you want to look at the label. You have to do that in order to identify the drug to take down off the shelf. And then when you're about to count out the tablets or draw up the drug in a syringe, you want to check the label again. And then before you're going to give it to the animal, you want to, as you're placing that drug back on the shelf, you want to check the label again. If you do that, in one of those times, if you have just taken it for granted, and we get very distracted because clinics are very busy, you should be able to catch yourself uh, potentially, if you have taken the wrong drug off of the shelf. You want to check your calculations 3 times. Again, do it twice before you count out tablets or draw up the medication. And then again, before you're going to give that to the animal, you can do an estimation and make sure that you're giving the correct amount to them. That makes sense. And then also, if it's something that's unfamiliar, you can check the dose against another dose for another drug. If you're familiar with another client that is being given this drug, or you can ask someone in the clinic to double check you. There's a lot of different ways to think about this. Definitely, if you're giving something that is inappropriate for that size of animal, too small of an amount or too large of an amount, let's say for a small animal, that can get to be known. I had an example myself where I was very busy one day. A rescue group brought in an animal for euthanasia. It was an elderly animal that they didn't have the money to treat. It was a miniature pinscher, so that's a relatively small dog. I was asking the technician to draw up 20 milliliters of euthanasia solution, and they stopped me, fortunately. And I was off by a magnitude of 10. Obviously, it was 2 milliliters that needed to be drawn up. In this particular situation, it would not have had too bad of a result, but I would have looked very bad walking into that room with 20 milliliters of a solution to give to an animal that was, I believe, in the 20 to 30 pound area. So it's really important to have practices in place so that you can check yourself. And I would read through that list of different procedures that have to be done in your book about, for successful drug administration, because it is interesting to note how many different things have to be done in order to be handing the appropriate drug to the owner. All right, so your book also lists some common medication errors. We're going to go over these in lab because this is where we're going to use them. So I'm not going to belabor them, but I'm putting them here um, in the PowerPoint. I will probably pull this up when we get to lab and we'll go over these. So I've got several groups of them, and then we're going to also talk about rounding. But this rounding is really important to know, and we'll talk about it in lab. It is the way I will round your grades even. So you're going to become very familiar with this form of rounding. All right. Also in lab, we're going to work with abbreviations. So you need to be familiar with this table 2.1, and you're basically going to need to know everything on this table because we'll be using them in writing drug prescriptions or medical records. So you need to be familiar with them. So prescription abbreviations, we will cover this in lab too, but the timing of administration, I think you're all pretty familiar with it. I will point out some things. So SID is not used so much in human medicine, and so we need to be careful if a prescription is being sent to a human pharmacy. QD, which means every day, or once daily is the preferred thing to use. BID, TID, QID, you're probably familiar with those. I would point out that QID, some students get confused with that one and QOD. So QOD means every other day. QID, just like BID, TID, it's that format, but it's 4 times daily. PRN is as needed. STAT is immediately. And I'll point out that Q and using Q 4 hours, Q 8 hours, that is probably better practice than using QID or TID. And the reason I say that, at least as far as communicating to an owner, and some drugs you definitely want to be in those intervals. It's really a better practice to do it by how many hour intervals it is. When you ask an owner to give something twice a day, they may think in terms of convenience for themselves, and they will have to in the end. We all have to, but um, it, when you give an animal something twice a day, an owner might think in terms of, well, I'll give it at breakfast, which might for them might be 8 or 9 o'clock, and then I'll give it again at dinner, which might be at 5 o'clock, and that's not 12 hours apart. So you want to try to think in terms of helping the owner to think about when to give a drug if it needs to be given at specific intervals between um, when the doses are given. So some other prescriptions, this says metric units, but pounds is actually in this as well, and that's not a metric unit. But we need to convert between pounds and kilograms, cubic centimeters, grams, grains. We'll go over these again, milligrams, milliliters. And then method of administration, you're probably familiar with all of these. And and then eye medications have some special um, abbreviations. So OD is right eye, OS is left eye, OU is both eyes. I'll let you think about the ears if I think you've had that before, but you can look in your table in the book. It gives how the ears are abbreviated. And then some very common abbreviations, and we'll use these when we're asking owners to give things maybe to help the animal to vomit, or if we have some pediatric medications that an owner might have at home or able to get at a pharmacy and give to their animals. So teaspoons, tablespoons, and DISP refers to dispensing. GTT refers to drops. We'll be using that when we calculate what we call drip rates. Sometimes we're giving fluids in terms of a drip rate, and so that abbreviation is GTT is for drop.